Hello again. I'm back with another video, and today we're talking about every type of surgery that I could think of that you can do on your FTM journey. So this is episode 3, I guess, on what to expect when you're transitioning or whatnot. So I will go through first the list of the most common, most basic surgeries that everyone knows, and then I'll go to the other surgeries that are or are not required depending on where you are to continue your full sexual reassignment surgery, or the ones that you can have and the ones that you can optionally have if you want to or not. So let's get into it. The most common ones I'm going to talk about first is the mastectomy or top surgery, and bottom surgery, which you have either phalloplasty or metoidioplasty. So today I'm not going to go into massive details about these surgeries. Please go search it up yourself. I'm just going to go with the very basics of what they are. And then after that, I'm going to talk about the not so common surgeries, or surgeries required that you need to do if you want the full sexual reassignment surgery certificate or whatnot in some countries. Which includes the hysterectomy, which means you take out your ovaries, and there are also more optional surgeries which you can get, which I'll talk about that later. So let's just get into it. First of all, mastectomy, top surgery. There are many different types of top surgery depending on the size of your breast and also depending on how you want the results to look. Like I said, if you want to see a good gauge, if you want to have a good gauge on what each procedure will look like, first of all, look at your doctor's page. Every doctor has a different technique, and go look at TransBucket. They really have good information on it. So first of all, there is the one with if you have smaller size breasts, which you have no scars, which they cut under your nipple, they take the tissue out, and then they just sew on your nipples, and you won't see a scar, you won't see a thing. And the good thing about this is no scarring, but what I've seen personally, which I don't like, is that you don't get your chest shape isn't exactly like this tight. It's more like pressed down, but you can still kind of see like the boob shape a bit. Go search it up. There's a lot of different references for this. Another technique is the O-shape technique, which is you cut an O, a big O, and then you cut another ring, and then you just sew it in together, so all the scars will be on your nipples. Good thing about that is there's no scarring as well. I haven't seen this technique done, but I've heard about it. Another one is the keyhole technique, where you cut under the nipple, and then you cut down, and you cut like that. I personally don't like that method because I don't really like the type of scarring it has as well. But I mean, a lot of them are primarily due to breast size or the technique that your doctor uses. And then the most common one, which I have, is the full mastectomy, which you see I have massive scars, which I am currently going through laser scar removal, and I'm doing keloid removal right now. It's gone a lot better now. I'm not going to talk about myself. I'm going to make a video about that. Anyways, the biggest downside to this one is if you don't take care of it properly, or if your skin is really prone to scarring, you're going to get this. But there are a lot of guys who really take care of it, who really like take good care of it and have no scarring whatsoever, or you could barely even see it. Not that I have my body isn't that prone to scarring, but I'm just a really bad guy. I just didn't listen to the doctor. Within 2 weeks, I started lifting weights again. I started swimming and everything, and that's why my scarring is like this. Please listen to your doctor so you don't have to waste money like me having to get rid of the scars again. Okay, that's the gist of it. Next one, bottom surgery. So first of all is metoidioplasty, the one that I had. I have another video on that. You can go look at my channel. Basically, it is a small or neophallus, a mini penis that is used from the natural growth of your clitoris, which basically they just pull it out, they cut the ligaments, and there are very many options that you can do with this. Is you can choose to close your vaginal canal, which you close your vagina, and have a scrotum made and have testicles put in, which is like the full metoidioplasty. Or a lot of guys, which I've seen, is they opt to keep the pee hole and just release the mini penis, or they just release the mini penis and not close any of the holes as well. I forgot to tell you, you can also stand to pee if you choose to for this one, or you can also sit to pee if you choose to. Okay, that's really just the basics of it. I have a more in-depth, detailed video of it go look at my channel, like I said again. Phalloplasty, that is the male-sized penis. It is average in size. The difference between phalloplasty and metoidioplasty is that metoidioplasty is your natural growth. You naturally get erect. You have 100% cessation. This one is you cannot naturally get erect. You need to use an erectile device. And I don't know about feeling. Some people say they have pretty good sensation. Some people say it's dull. I don't know. But basically what you have to do is you need to have a donor site. Donor site meaning that you need a piece of skin from either your forearm, your latissimus dorsi, your abdominal area, your thighs, or your leg. So each different method has its pros and cons, but every method you're gonna have a scar no matter what. Basically what they do is they need to make a neo-urethra, so they're gonna put like a tube in between your arm or anywhere in the area. I'm not sure about this one. I don't have much information of this one. I know the abdominal one, you don't need to use the thing. They can just roll it up. I don't know how. I've heard of it, but bear with me. So basically they're gonna put it for at least 6 months, I think. Minimum 1 to 6 months, depending on how quickly the nerve endings grow. And then they cut off that part of your skin, which you'll see that a lot of the guys who have phalloplasty have massive scars either on their arms, their legs, their back, or whatnot. And then they attach it to your genitalia to make a average size male penis. The thing about this is a real male penis shrinks and it gets erect. This one, it doesn't shrink. So whatever size you choose, it will be that size. So please be careful if you do consider this one that you're gonna have a really, really big junk unless you don't mind having a big one. But it kind of can look weird. So just keep that in mind that it's not gonna naturally shrink and it's not gonna naturally get erect. So on the later stages, you need to get a erectile device put in if you want to get an erection. I know the one with your leg where you use your fibula bone has natural rigidity, but you can only get a small size. I wouldn't mind that, to be honest, because if it's naturally rigid but it's not that big, because then in my pants it wouldn't look weird, I would get it. But they said there can be possible complications with regrowing of your bones and it make your bones weaker, and me really loving sports, I'm not really willing to risk that. So yeah, that is phalloplasty. Okay, the next ones, which is the not so common surgery, is first of all, is a hysterectomy. That's removing your ovaries. You can choose to get it. You can also choose not to get it, depending. I already did everything. I got it all. I got mastectomy. I got hysterectomy. I got metoidioplasty. I got scrotoplasty, which is making scrotums, and I have testicles with little implants in. I can stand to pee. But basically with the hysterectomy, it's optional in some places. I don't know if some places you have to do hysterectomy first and then you can do phalloplasty or metoidioplasty. In my case, it was that way. Like, they won't let you do it unless you get your hysterectomy done. I didn't mind that. I was already planning to do it. Some of you guys can also plan to keep your ovaries. I don't know if this is real or if this is just a myth, but apparently by 10 years, you're gonna want to get it out, because by 10 years of taking testosterone, you're gonna want to get it out because you can have possibility of having ovarian cancer. But I don't know. The methods in this one, there are 3 methods. There is the old method, the old method where you cut a line in your pelvic area and you take out the ovaries. There's another method, which is the microscopic one, where you use when it has like a little hole scar. Or the new method, which is no scarring whatsoever, is they go through your vaginal canal with microscopic surgery and they pull it out. That's what I did. I have no scars. The difference between all of them is, one is pain, recovery time, and price. The other optional surgeries, which I've seen a lot of guys do, is facial masculinization. So what that is some guys choose to get their nose a little bigger, they get their jaw augmented, brows. They try to make it more protruding. You can also, I don't have much knowledge. These are just like the extra ones that you might not have known. Also, you can also get hair transplant if you want a beard. You can get a beard transplant. That's optional as well. And also an important one, I'm sorry I put at the end, is still the little things in the bottom surgery is urethral lengthening, which I said is where you can stand to pee. For phalloplasty, anyway, you're gonna have to get it. You can choose to get your scrotum made. You can choose to have balls or not. You can just have a penis if you want without the balls, which is scrotoplasty. And you have to have the little implants put in, which I did. So yeah, I don't think there's any more, and there might be, but I just might not know. Oh, you can actually get your Adam's apple put in as well, but a lot of guys will naturally get pretty good Adam's apple growth. Mine is like medium, it's not large, it's not small. But look at natural men, like some natural men don't even have an Adam's apple, so don't be discouraged. I'm sorry, I'm getting off topic, but basically, that's all for the surgeries. I know it's very, very basic, it's very vague. I just wanted to go through what types of surgery they are. I don't want to go into too much detail because I'm sure you can find many more detailed videos and you can actually search it for yourself. But yeah, that's all for today, and I'll see you in the next one.